Thank you very much for having me. It's an honor and a pleasure to be here. Thank you, Nada. Thank you, Shima. Thank you to the organizing committee. I have to say that I'm so much impressed, so bravo.
Thank you.
It has been a wonderful conference so far. So I thought I'd use a little bit of humor. It's 5 o'clock. You guys are tired. You had a very long day. And then, yes, just like Amrita, I wasn't expecting this title. I have nothing to disclose, but in fact, the fact that I love my job. I love it very much. I love it to death, to the point that I never thought I had one working day of my whole life, which is a problem because I do also love endoscopy, not only surgery. I do really, really love research. I love teaching very, very much, and for those of you who know me, you understand that, and I do also love innovation. So I burn out nearly, not quite, nearly, quite often. So I'm not the perfect role model to give this talk. And I am the solely caregiver for my 20-year-old daughter, my cat Tom, who's 8, and my very needy 40-year-old dog. So that adds another layer of commitment. So that's life, basically. I really don't like the term work-life balance. Why? Because it's not really a recipe. Whenever you Google, we were talking about Google, work-life balance, you have the picture of a scale, perfect like this. Just like if you could put the same weight on work and the same weight on family. That's impossible. Now, I'm not very good at math. Actually, I hate maths. But if we live a 24-hour day and you want to dedicate 8 hours to work, 8 hours you sleep, in 8 hours, you're supposed to have family time, personal time. So just question in the room, how many people always have 8 hours sleep? None. How many of you have 8 hours of family, personal time? How many of you have more than 8 hours of work? All right, so that's why I don't think that work-life balance is the right term. What I'd like to talk about is wellness. Because in order to be happy at work, in order to be happy at home, you have to be well. So what is wellness? The quality of state of being healthy in body and in mind, especially as the result of a deliberate effort. So you're not well unless you try to be well and you make an effort. In contrast to burnout, burnout is when your engine is melting. That's not applicable to us, but is exhaustion of physical, emotional strength or motivation, usually as a result of prolonged stress and frustration. Now, that for us physicians, surgeons, and internists has a completely different meaning. And being well is not the complete opposite of being burned out. So it's not quite simple as that. Why is that? Because we do a tough job. Because we can have moments when we are exhausted, when we don't feel like ourselves anymore. Our family tells us, what's going on? You're not yourself anymore. When you don't feel accomplished, when sometimes you do feel like an imposter, that you don't belong there. So this is a recognized workplace hazard and is very, very dangerous, like a fire, actually, a wildfire. Why? Because 69% of residents, so people who are just starting the career, who have so many less responsibility that attendings, are burned out. 44 consider dropping off training. 44 would not go to surgery, and I don't think that the numbers in GI are very different. And women, of course, are more exposed to burnout in general. Now, do we get wiser, better when we get old? Not really, because 40% of us are burned out. Because actually we do have more responsibility. We do have more responsibility at home too, which doesn't help. And of course, some of us don't treat it and become also depressed. So what are the consequences? You would think that there are consequences on yourself, fair, but there are consequences also on your job, on the patients. So we're treating patients. So you will have, we were listening to patient satisfaction just before, you will have reduced patient satisfaction. You might have a higher complication rate. If you are in an academic center, you will see your productivity decrease, plummet. And then also, some of us, unfortunately, commit suicide if they're very depressed and they don't take care of that. And actually, it's a very high percentage if you put everything into the context. So what about women? Well, women have something more, which is called invisible work to add to that. When you get married, you're happy. When you are sharing your life with a partner, you're happy. But that really gives you 7 hours per week of extra work. Now, this work is not paid. This work is invisible. Men, on the contrary, they gain 2 hours of freedom because there is somebody else who's taking care of that. I see a lot of the gentlemen smiling, yes. Wait until you go home if your wife sees that. Now, what is invisible work? It's the things that really you have to take care of in a household. You have to pay the bills, you have to plan things for kids, you have to plan financially, because sometimes women are much better than men doing that. You have to eat, so you have to go grocery shopping. You have to, you want to go on vacation, you have to plan for that. You just don't improvise all the time. So all of these things do add a consistent burden to your life. And of course, they contribute also to burnout. Now, pregnancy. I have a daughter. I'm sure I've seen a lot of kids running around. I'm sure that a lot of the physicians in the room have family and kids. Now, the work-life balance or for women is also complicated related to pregnancy. We as surgeons, but as physicians in general, we have less children, we have children later in life, we have more complicated pregnancy, we have unfortunately more rate of miscarriage, and all of this because of the stress and the amount of work that we do. We chose it, so it's fine, but you have to understand this and you have to know it because it's a very, very personal choice. The other problem is that if you're pregnant and you're a physician, unfortunately, all over the world, in every single country, in every single institution, you will not have the same attention professionally as if you were not pregnant. So every single woman, when she becomes pregnant, feels that she's losing something compared to her male peers. And what does it mean? That we have children much later, which decreases the likelihood of having children at all. Now, the other problem is that if you expect this problem to be only seen as a woman-only problem, you really need to redirect the conversation. It is described in the Bible, but I think it's the only case where a woman, Mary, had a child alone. So now, usually it becomes a problem of a couple. So we have to stop focusing only on the mother. We have to focus only on the father. And so it is really time that institution, especially hospital, academic institution, but also research institutions start to encourage a paternity leave, which should be mandatory. One of my former resident now is pushing in Italy to make it mandatory for dads to take a leave and take care of kids. And of course, you should encourage also a childcare facility at your working institution, which is something that would highly simplify the work. But unfortunately, most of the time, the hospital is not taking care of those things. And you have to try to do it yourself. So I'm going to give you just 10 advice. This is not a recipe for success. This is just something, just as Amrita was saying before, these are my personal opinion, what helped me. So know yourself and your goals. You have to understand, what do you want? What drives you? What are your priorities? What makes you happy? What makes you sad? What makes you angry? What you want to do in life? What you want to specialize in? What is your value in your own institution? Do you want to be a clinician scientist, an educator? Do you want to be a public health advocate? Do you want to be a clinician administrator? So pick something that is personal, that makes you happy, that makes you proud, and that you can excel in. Know your environment. I found this very, very amusing, and I want to share it with you. All of us, when we speak publicly, we speak very highly of our working environment. That is fair. But in truth, sometimes it's very hard. And you can have difficult situation at work. So this is a primer for sponge divers. And it tells them how to swim with sharks. Assume all unidentified fish are sharks. Do not bleed. Practice how to be injured without bleeding. Counter any aggression promptly. So this is something that is amusing, but I think that most of you can relate to something like this. And then very, very funny for women, we bleed every month, especially do not bleed, because otherwise you will be attacked. So it means do not show fragility, because that could prompt more aggression behavior. So choose a job where this is not going to happen. Choose a situation where you can succeed. And the ideal job should really combine autonomy and values. You should have direct relationship with your supervisor, which is going to support your vision and your goals. If that's not the case, that's not the right place for you. And then, you know, if you really do not have those things, you have two choices. It's very simple. Either you go towards burnout, or you need a career change. And that is something that is very, very difficult to accept, but change is not always bad. You can evolve into something different. You can feel free to decide that you want to take a break and do a sabbatical, or do a research year and have your kid, and then go back stronger, more prepared than before. So all of this is very acceptable. Choose a job situation that makes you really realize what you want to be and what you want to do. I had a very long list. I wanted to be in a center that was the top of the world for MIS, where I could do endoscopy, I could do surgery, I could do research, I could do innovation, I could travel. It took me a while to find it, but I did found it. I found a mentor, Bernard Nalman, who told me to operate beautifully. I could travel to the IRCAD all around the world. I could teach, and I have a fantastic team of very young future leaders that help me achieve all my goals on a daily basis. And then prioritize, get organized, and reprioritize daily. What works for 1 week is not going to work for next week. It's very difficult to juggle between clinical practice, self-care, academic and research, your social life. You have to have time for your friends and family. Normalize saying no. It's okay to say no. It's okay to say no for a last-minute talk. It's okay to say no to a last-minute deadline, and that is not. You have to say no without apologizing. When you negotiate your job, negotiate not only money, negotiate also time, because time is very valuable. And then give yourself some grace. You cannot be perfect every time. And this is something women do really, really have a problem with. We are perfectionists. We have DNA OCD. Everything needs to be perfect. Perfect at home, perfect at work. We take 3 times the time that our male counterparts do. Not because we are slow, but we want it to be perfect, every little details. You don't have to be the workaholic, the superhero, the perfectionist, or the Lone Ranger every time. If you do have a problem, ask for help. If you do have a complication, ask for help. It's not the end of the world. And then really create a network of mentors and sponsors. This can be, of course, men, but this can be also women. You have to have friends in this environment. You have to be friends with your co-workers, because that's going to become a very important part of your life. You need people who will tell you what to do, where to go, that will give you advice on how to improve your position, how to have more high profiles job, how to become a leader. And this is something that you have to start doing right now if you don't have it already. And then please do develop your life outside of work. This can mean family, but you have to have something that gives you joy. What gives you joy? It's very personal, it's different for everyone. For me, cooking, painting, going to a museum, traveling. I make wine, I harvest honey, not very successful every time. I do free water, open water swims. I do love to take times to spend time with my daughter. So really do that and make sure that you schedule every week some me time, some you time, because that is the only thing you can actually control. And then, do it also because if you're killing yourself for a job that will replace you within a week, if you drop dead, you might as well have fun in your life. And then take care of yourself, take care of your body, exercise, sleep, eat well, and repeat, because we're doing a job that is not designed for us. We're working in operating room using scopes, using devices that are designed for men. So we suffer from that. 80% of women in surgery and endoscopy have musculoskeletal pain that is chronic and will impair them in their quality of life, which means doing the things that you actually like. We have it before men, and we have more pain associated with it. And then last, surround yourself with love. This seems cheesy, but it's really not, especially if some of you knows or recognize this lady. This is Christine Lagarde. She's the president of the European Central Bank. She's fierce. She frightens all the men in the room and also those who are outside. But she says that the most important thing in life is surround yourself with love, which means family, partner, friends, and you have to ask yourself every single day, did I help any other woman today? Because as Madeleine Albright said, there is a special place in hell for women who do not help other women. Thank you very much.